Ransomware is malicious malware that hackers use to lock computers and block access until they receive payment from their victims. These attacks keep increasing. From Q4 of 2018 to Q1 of 2019, ransomware attacks increased by 195%. In Q2 alone, ransom payment increased by 184%. Healthcare centers fall victim to these attacks because of the valuable medical record information on the dark web. Hi everyone, I'm Matt Moneypenny. Today I'm going to go over healthcare ransomware horror stories from 2019.
Before diving deeper into this subject, make sure that you subscribe to our YouTube channel. Also click on the alert bell icon so that you're notified when we post new helpful content.
Retiring early doesn't sound scary, right? Well, when it's because of ransomware, it is. In March of 2019, two doctors who ran Brookside ENT and Hearing Center decided to retire early when they were hit with an attack demanding $6,500 to unlock the system's files. There was no guarantee that the code would work, so the doctors decided to close the practice rather than pay. This wasn't only horrific for the doctors, but also the patients. The patients' medical records were erased, so they couldn't send their records to a new doctor. Patients who just had surgeries had no way to follow up, and a new doctor had no way of knowing specifics about their procedures. Getting hit with a ransomware attack once is bad enough, but how about twice? Park Duval was attacked in April and again in June of 2019. It was lucky enough to avoid paying the ransom for the first attack by restoring data from backups and rebuilding their system. But the lockdown still lasted for about 3 weeks. The attack in June was a little bit more tragic. This lockdown lasted more than 7 weeks and the practice was unable to rely on backups. There was no choice but to pay the $70,000 ransom. The total cost of the attack totaled over $1 million. On June 10th, the employees at Ennio Urology came into work one early morning to find that hackers held all of their medical records hostage, demanding $75,000 in Bitcoin. This organization couldn't rely on backups, so they had no choice but to pay the ransom. Not only did they lose $75,000 from the ransom, but the loss in revenue during downtime was another $30,000 to $50,000 per day. June was a hot month for ransomware attacks in 2019. While people prepared for the hot sun and sandy beaches, two more healthcare organizations got hit with similar ransomware attacks. You think vacation is expensive? Well, the practices had to pay $1 million to restore access to all of their medical information. Luckily, the backup procedures they used recovered most of their patient information. Happy holidays? More like horrific holidays. This attack was by far the most horrific ransomware attack in 2019. In August, attackers locked all of Wood Ranch Medical's health records through encryption. These records were unrecoverable. Wood Ranch couldn't restore patient data, forcing them to permanently close this December. Imagine that you needed medical assistance, but the nearest health center told you they couldn't help you because their computers were down. That's exactly what happened to DCH Health Systems and Campbell County Health while they faced ransomware attacks. Both organizations had to deny new patients during downtime because they couldn't access their computers. Think about how devastating that is. There were lives on the line. Ransomware attacks keep growing each year. Your organization needs to follow best practices in order to avoid and prepare for an attack. For more information on ransomware attacks and its preventions, reach out to Etactics. And if you enjoyed the video, like it, share it, and comment below.